Hello and welcome to the Processes and Documentation in the Primary Care module. The first section of Processes and Documentation which you will need to learn is the clucking. This will be one of the core tasks required from you. Having good documentation skills and clerkship skills are going to be an advantage throughout your training. So patients who come into primary care would usually be those with general complaints or could have been referred from other health centers such as nearby clinics, private general practitioner clinics, and medical outpatient departments in tertiary centers. They may also come for follow-up for their underlying medical illness, blood, radiograph investigations, and medications. Sometimes patients who are discharged from the ward will also be seen again as a follow-up review in the clinic. At most times when the patient arrives, their vital signs will be taken by the staff nurses or the community nurses or the medical assistants prior to the doctor's consults. They will alert you or your medical officers of any cases of abnormalities or emergencies. So as the house officer here, you play quite an important role in clerking the patient's history, performing the physical exams, ordering investigations including the lab works and imaging studies. You'll be expected to familiarize yourself with the expected consultation time as there's usually a large number of patients scheduled for review. At times, there are simple bedside tests which you will need to carry out to aid with the diagnosis and management accordingly. Besides that, you're also expected to ensure all orders are carried out accordingly as well. Should you face any hiccups in performing them, always remember to seek help from senior colleagues or from your team members or medical officers in charge. You would then always present the cases that you have seen to your medical officers or to the family medicine specialist in charge to discuss and get a plan for the patient. When you're done with your clerking and physical exams, you will need to present your case to the medical officer or the family medicine physician who is present in the clinic. Write or type out every point and plans given by your superiors. Once the patient is seen by the medical officer or the family medicine physician, always write their respective names on your clerking, such as seen with Dr. A, discussed with Dr. B, or attended with Dr. C and Dr. E. So now let's move on to follow-up visits. Majority of the patients will require a follow-up visit. They would come in for either medication follow-up, health checkup follow-up, and many other reasons. Some may come in for procedures as well. So most procedures are carried out by staff nurses as they are experienced, such as for example, for change of Ral's tube or urinary catheters. You also will need to remember many mothers will come in for antenatal follow-ups and also may bring in their children or babies for vaccination. So patients who have just had an operation of wound debridement in the hospital may also come over to the primary care for wound dressings and further follow-ups. So once you have done your reviews, present your review findings to your medical officer who will be doing his or her part of the review as well, as there might be changes and additions to your review. Ask yourself these questions when you're seeing these patients so that you don't miss out any important points. Why is the patient here today? How is the patient doing today? What have we done in terms of tests and treatment? What are the future plans or advanced plans? And what are the impending test results? Now let's look at how orders and procedures work. So here identify what is the test that needs to be done. Outline the purpose of the request, urgency for the test to be done, how the test will be able to aid the diagnosis and management of the patient. Identify the criteria needed for the requested test and identify the documents that are required to be filled. To place requests or orders, the steps are as follows. So first you'd want to complete the request form for the test. You inform the nurses on the plan to transport the patient over to the location of the test or whether there needs to be collection of specimens for the test requested. And then you come to understand that there are certain tests that can be done in the primary care setting. And these would be basic routine blood tests such as full blood count, renal profile, a liver function test, cholesterol, fasting sugars. You can also do a MAN2 test, a sputum AFB, radiographs to look at your chest x-rays predominantly or sometimes at limb x-rays, antenatal ultrasounds, kidney ureter bladder ultrasounds. You can also do wound dressings and administer medications as well. Now moving on to referrals. So, referrals from primary care are made to hospitals and specific departments for their management input or suggestions, or if their skill sets are required in the management of the patient. So, what's your role as the house officer? First of all, if you had to make the referral, you need to identify the purpose of the referral, the departments involved, identify the officer in charge of accepting the referrals from the receiving department, to call the medical officer in charge or the specialist in charge, and to document the trail as to the time at which referral was being made, the indication, and the medical officer who accepted the referral. If your referral is not accepted, take down the point as to why it was rejected and convey the information to your medical officer. Your medical officer will be responsible to troubleshoot the situation. So this is a quick outline on your roles in performing a referral. So you identify the purpose of the referral, the departments involved, the medical officer in charge, calling the superiors, as well as documenting the trail. Now let's take a look at an example of a referral from the primary care to the medical department in the nearby hospital. So here we have referrals from primary care to tertiary centers, and these are usually carried out by generally medical officers. However, in-house referrals to the dietitian or physiotherapies can be done by the house officers. So here, you can begin with communicating clearly and confidently when you're introducing yourself. Begin with mentioning, "Good morning, Miss So-and-so. I'm Dr. Betty, the house officer from Klinik Kesihatan Ceras." So you can state the patient's details as well as the reason for the referral. So I would like to refer the case of Mr. Y for a diet review for his poorly controlled glucose readings. You can then carry on by providing them a little bit more information regarding the patient's current follow-up reviews, past medical history, current medications, the patient's social history, in order for the dietitian to understand and probably tailor a management plan for the patient prior to the patient's review with them. So, we have concluded the processes part of the primary care module. Please look at the downloadables that are attached here for the documentation part.